Folks, I have a new patient with very flexible joints. Well, yes, joints. This young man is probably the most flexible guy I've ever seen. Let's see some of the things you can do. Oh, whoa.
I can put his finger up.
I can't get very far.
Wow.
That's pretty flexible. All right. Oh, look what he can do with his thumb. Whoa.
Backwards.
I can't even begin to think about. What are you doing?
I can do
It's
that.
this joint that's popping out to go backwards.
Oh my goodness. And was his thumb doing that too?
It dislocates here.
It
Oh,
dislocates
yeah,
there.
like you just did it.
Oh,
Yeah.
what? Oh, oh no. Be careful. That's amazing. Be
But
gentle,
this-
be gentle.
Yeah.
Okay, oh yeah, oh be careful. Oh my goodness.
I can make my foot touch my head, the
Well-
top of my head.
How did I know that? Oh, wait a minute. I can't even get my foot past my waist.
Dr. Thomas?
Yes.
Oh, get off the fan, get off the fan.
Can you? Oh, careful. Did you bump your head? Oh, good job, good job. All right, don't do it again.
Okay, then the other thing you can show is how your legs come up this way. Remember how you pull your legs, put your foot here? Remember how you're doing
Oh my
that?
goodness. Let's see. So folks, I didn't want to say anything in front of this young man who is obviously so delightful and just eager to share with us his hypermobility. The parents came in with an awareness, and we'd already talked about it, that this young man probably has EHLERS-DANLOS syndrome. So we're going to give you a link to a very important website that has just about everything you need to know about that. You can also visit the EHLERS-DANLOS.com, which is the EHLERS-DANLOS Society website. The reason this condition is sort of very important to know about is that in rare cases you can have things like your aorta can rupture. So you need to be seen by a cardiologist. When you understand the underlying causes of what's going on, there are things that can be done to reduce your risk. And certainly in this young man's case, just figuring out the connection with his immune system was helpful for them to alleviate a lot of his symptoms with his GI complaints, his constipation. He's also having, we didn't go into it in front of him, but bedwetting and daytime wetting that either is related to his constipation or might be just separate from that. But hey buddy, if you're watching this video, I'm so proud of you. You were a trooper, and this will be very helpful for everybody who's watching who has never even heard of EHLERS-DANLOS and who needs to know about it. There are multiple types. The classification has changed over the decades. There used to be 6 types, then 13, maybe 17, reduced to different numbers. The reason is it's genetically inherited 2 different ways. Either autosomal dominant, which means if one parent has it, they automatically give it to the other kids, or a recessive type where you may get it or you may not if one parent has it. In this particular instance, you saw both parents had some features of joint flexibility that was unusual. I forgot to have Dad show you because he had shown me before when you lifted his skin, it just went way up, like 3 times as high as I'm talking, and that's another feature of EHLERS-DANLOS. EHLERS-DANLOS. Huh. It's a tongue twister for this old guy. Anyway, I just wanted you to see this so that you can think about it. If you have a condition or in your family you've got somebody you're worried about that's always been unusually flexible, oftentimes their wingspan, which is your arm stretch, is greater than your height by just a little bit, and that's slightly unusual. Usually if you measure tip to tip, it's slightly less than your height. That's another way of kind of saying, this might fit this condition. Anyway, enough babbling from me. Thanks for watching. I'm Dr. Paul.